Imagine learning about a bone condition, only to find it is incredibly rare and complex. Understanding every type of bone cancer, even the least common, is so important for peace of mind and proactive health. Angiosarcoma of bone is a very rare and aggressive type of cancer. It develops from the cells that line the inside of blood vessels within the bone itself. This cancer originates from endothelial cells, which from the walls of your blood vessels. Because it starts in these vascular cells, it tends to be highly invasive and can spread rapidly. Its rarity means that fewer cases are seen, which can make diagnosis challenging for general practitioners. Several factors may be associated with its development. Sometimes, it can arise as a secondary cancer, meaning it develops after prior radiation therapy for a different condition. It can also be linked to certain rare genetic syndromes, like Maffucci syndrome or Klippel-Trenaunay syndrome, which involve abnormal blood vessel growths. Understanding these underlying mechanisms helps medical professionals approach diagnosis and treatment. Diagnosing angiosarcoma of bone typically involves a combination of imaging studies, such as X-rays, magnetic resonance imaging, or MRI, and computed tomography or CT scans. However, a definitive diagnosis almost always requires a biopsy. This is where a small tissue sample is taken from the suspicious area in the bone and examined under a microscope by a pathologist. Due to the complex nature and rarity of this cancer, it is vital to be evaluated by a specialized team of doctors who have experience with bone sarcomas. Treatment usually involves a multidisciplinary approach, potentially including surgery to remove the tumor, radiation therapy, and chemotherapy. Newer targeted therapies, designed to attack specific vulnerabilities in cancer cells, are also being explored. One intriguing aspect of angiosarcoma is its ability to sometimes mimic benign vascular lesions or other more common bone tumors. This can lead to diagnostic delays, underscoring the importance of persistent investigation for any unusual or persistent bone pain. Unlike osteosarcoma, which forms abnormal bone tissue, angiosarcoma is a purely vascular tumor, focusing on the blood vessel components of the bone. This distinction guides specific treatment strategies. Understanding that angiosarcoma of bone is a distinct, rare, and aggressive vascular cancer emphasizes the critical need for a thorough and specialized diagnostic approach. If you or someone you know experiences persistent bone pain or swelling, advocating for a comprehensive evaluation by an experienced medical team is paramount. Early and accurate diagnosis, guided by experts in bone sarcomas, offers the best path forward for managing this challenging condition and optimizing treatment outcomes.